As is natural during a transition, we've had 6 weeks to do what normally takes 6 months. This document is an overview. There will be more detail available in April. We will then, throughout the year, continue the process of examining what works and what doesn't in the federal budget. And next year, we will have that full 6 to 8 month timeline to put together our full budget in addition. So this is an overview. There is more to come over time as we continue to examine what works and what doesn't. We, in this budget, have already, though, identified specific policy interventions that will help to cut the deficit in half over the next 4 years. So by the end of the president's first term, the deficit will be reduced in half. I should say, in response to some media reports that were out this morning, we're being very clear we're not raising the price before a sale. This is deficit reduction relative to the deficit that we inherited before the Recovery Act and before any of our policy interventions. That deficit will be reduced in half by the end of the president's first term. So I want to be very clear about that. How does that happen, and how do we get that deficit reduction? There are 4 main categories of deficit reduction mechanisms. The first is that we do expect, in large part because of the Recovery Act and also because of the normal business cycle that occurs, that eventually the economy will recover, and you'll hear again more about that from Christy Romer. That does help to reduce the budget deficit. In addition, as the president campaigned on, we are allowing the high income tax provisions to expire when they are scheduled to expire at the end of 2010. And in particular, what that means is that although we are cutting taxes for 95% of working families, families making more than $250,000 a year will be asked to pay more in revenue, in taxes, in 2011 and thereafter. In addition, we are closing down a variety of corporate tax loopholes, including involving international transactions that help to reduce the deficit. Third, we are winding down the war, and that will reduce costs over time. Fourth, we are making government more efficient, and let me be a little bit more specific in that category as we begin this process of examining what works and what doesn't. There is solid evidence suggesting that each dollar spent on program integrity, that is making sure that, for example, under the Medicare program, providers are paid only when they are supposed to be paid and not improperly paid, that a dollar in additional program integrity funding yields $1.60 in savings in reduced, basically erroneous payments. There are similar solid evidence with regard to the tax gap, with regard to the Social Security Administration. All told, the budget contains almost $50 billion in reduced errors and improper payments, both on the benefit side and on the revenue side, over 10 years. We are also looking at some things that we strongly support, but that simply don't work. This administration strongly supports encouraging work among low and middle income families. A big part of that involves the Earned Income Tax Credit, which has been a very successful intervention to encourage work among those families. There is, however, an advanced Earned Income Tax Credit, which under 1% of those who claim the Earned Income Tax Credit utilize, and which is subject to very high error rates. This budget proposes eliminating it, not because we don't support work incentives for low and moderate income workers, but rather because that program simply does not work well. I can go on. For example, in the agricultural side of the budget, we are proposing, as the president suggested during the campaign, a variety of changes that will reduce payments for large farms while protecting family farmers. I'll give you one example. There is a set of direct payments that are made to farmers that are based just on the amount of land they own rather than the farming they undertake. 36% of farmers receive these payments. The president is proposing to phase out those payments over time for farms with revenue of more than $500,000 a year. That would save $10 billion over 10 years. Another example involves inefficient subsidies through private lenders that support higher education loans. The evidence suggests very strongly that the government has a more effective way of providing those types of financial assistance to students. And we are proposing $50 billion, actually technically $48 billion in savings in that area. I can go on in more length, but that's the final category of deficit reduction. All told, there's $2 trillion in deficit reduction contained in this budget, roughly $1 trillion in reduced spending compared to the current policy path that we are on, and roughly $1 trillion in additional revenue compared to the current path that we were on. Finally, while doing that deficit reduction, the budget is focused on 3 key areas to promote long-term economic performance: education, energy, and health. In education, it builds upon the Recovery Act's investments in early education, because the evidence strongly suggests that high-quality early education programs pay off over time. It supports higher education through an expansion of the Pell Grant system and a more reliable funding source for it, along with a dramatic simplification of the application process for those grants. Currently, the application process for Pell Grants is more complicated than the tax code, and that complexity seems to discourage many students from even applying in the first place. In energy, we are committed to reducing our dependence on foreign oil, improving the energy efficiency of the government's own operations by 25% by 2013. Part of that will involve $15 billion a year in energy efficiency investments. So, for example, creating an electricity superhighway that would allow transportation of wind energy from the Dakotas to the population centers where that electricity is needed. Currently, there's not a connection that lets the available wind energy in the Dakotas get to the population centers that need the electricity. We would invest in things like that. That $15 billion a year would be financed in a fiscally responsible way, along with tax relief for working families through a cap-and-trade program that would be a market-friendly approach to reducing greenhouse gas emissions over time and thereby addressing global climate change. And finally, let me turn to healthcare. Healthcare is perhaps the most important driving force in our long-term fiscal gap. It is already reducing workers' take-home pay to a degree that I think is underappreciated and unnecessarily large. At the state government level, it is crowding out a variety of other priorities, including higher education. The single most important thing that we could do, and the reason that I am committed to getting this budget done this year, is reform the health system so that we bend the curve on healthcare costs and thereby put the nation on a sounder long-term fiscal trajectory, and also help working families enjoy higher take-home pay because their employers would not face as large healthcare insurance costs. How do we do that? There is very significant evidence that there are substantial opportunities to improve the efficiency of the healthcare system. Just yesterday, a new set of research was released from Dartmouth College showing the very substantial variation across parts of the United States in healthcare costs without any corresponding improvements in quality or outcomes in the higher spending, more interventionist kinds of approaches. We seem to have as much as $700 billion a year in healthcare tests and services that are unnecessary, that don't improve health outcomes, and that just add to costs, both for the federal government and for workers, without making anyone healthier. The way to get at that has been started in the Recovery Act, in which we invest in health information technology, we start to better measure what works and what doesn't, and we start to pay for better care rather than more care. This budget builds upon that by setting up a process in which we want to get healthcare reform done this year. We are putting on the table a significant down payment towards a more efficient healthcare system. It includes $634 billion towards healthcare efficiency, including reducing the overpayments that go to private insurance firms that cover beneficiaries under the Medicare program. We will introduce a competitive bidding process under which those firms would bid for the business of covering Medicare beneficiaries and would be paid the average of their bids. That is estimated to save more than $170 billion over 10 years. So I just want to emphasize again, while we're reducing the deficit, while we're being honest and responsible in the numbers, we are also investing in these three key areas of education, energy, and healthcare. And in terms of our long-term fiscal future, the single most important thing we could do is bend the curve on healthcare costs. I'm going to turn it over to Christy Romer, the chair of the Council of Economic Advisors, to talk about...
And at this time, we're going to